guys, Dr. Kristie Ennis. If you have tight hips like I do, and like so many people do, these 4 exercises today are really gonna help open you up really fast. All you need is a mat or a bed, and we are going to be kneeling, so if you want some extra cushion or something to hold onto, please grab that, and let's get started with the first exercise. For this first one, you're lying on your back. Remember, you can do this in bed, especially if it's hard to get down onto the floor. Before we get started, just to get a little bit more blood flow going, I actually do this before I get out of bed in the morning. We're just gonna take that derma edge and give a quick little fascial glide here and blood flow movement to some of those areas that are tight, like there. Okay, from here, you're gonna bring your feet about shoulder width apart, so they're nice and wide, about mat width if you're on a mat. Bring your hands out to the side, leave them down, whatever's comfortable for you. We're gonna take and we're gonna bring and rotate those legs to one side. You can press down on this outside leg to actually get a little bit more hip flexor stretch, but we're getting a little rotation and into the joint itself. So that's important. A lot of times people think about just stretching to get that hip to relax and open, but we have to get all of those components here. So you are going to shoot for about 3 to 5 on each side. See if you can actually get a little bit more movement as you go. One more on the ground or on the bed. You're gonna cross one leg over as best as you can. It's okay if it doesn't cross all the way. But now we're gonna take those hips and we're gonna drop them over to the side. So my left leg's crossed over my right. I'm starting by dropping them to that right side to get the stretch in that outer hip, and take a nice breath in. And then as you go to the other side, breathe out. Ooh, and now I'm actually getting the opposite hip in the opposite direction. So we're getting both of those rotation components in through the hip. And same idea, about 3 to 5 repetitions. Try to time it with your breath. All right, next to our kneeling. And please make yourself as comfortable as possible with pillows or a rolled blanket, whatever you need to do. Front leg obviously is going to go in front. You can bring it out to the side a little bit if you need to, if it feels like you need to open up a little bit more or your balance. I've got a chair here also to hang on to. But from here, you're going to think about squeeze that glute in the back leg because that actually gets us a better stretch. Tuck that tailbone under. You may already feel a stretch here. If not, you're going to take that hip and shift it forward, pause, come back, let go. You can even do a little pelvic tilt the opposite direction to get a little spinal mobility going too. So again, squeeze that glute, press that hip forward after you've tucked that spine under. And you're going back and forth here for about 5 to 10, really working through that hip flexor. Also, if you really want some more bang for your buck, I'm going to show you a way to get more into the joint with an assisted pull-up band. All right, with an assisted pull-up band, which I'll link for you guys, you can tie it around to something nice and sturdy. It doesn't have to be outside, but we're really gonna get through this hip joint, which is awesome if you have arthritis and anything else, obviously, too. But put it nice and high up in that hip joint. It's on the leg that's in the back. Same position like we were in, but now you wanna get as much resistance on that band as you can, and then you're gonna let it pull you forward. So shifting and tucking that tailbone, pull back against it, let it pull you back, and you should really feel a difference with this one. Shoot for about 10 of these. Last one, same kneeling position, but we're just shifting it around a little bit. So opposite leg goes out, toes are turned out. Again, you may feel a stretch just being here. Sometimes I do. If you need a little bit more and we want to get that joint involved a little bit, you're going to rock it to the side. So think again about kind of pushing that side to the opposite side. Only push as far as you can without pain. So you want to feel a nice gentle pull for any of these, but you never want to feel a strong like pull. That's never a good thing. So again, same repetition. Find this on actually 3 to 5 again. And if you can do this on both sides, that would also be great. And that's the same for all of them.